All
Sorry for the
right.
trouble.
Apologize for the little technical snafu there. Only 3 minutes worth, and it gave more people a chance to sign in. I see we have 87 folks this morning, and we actually have a really full meeting this morning. So I don't want to take a lot of time with introductions or startup. I would just ask that if everybody could mute themselves so we don't have any eruptions or anything as we get rolling. So today, this is the January 28th, the January EQIP Subgroup. We're going to return to our normal cadence of schedules next month. We were a little off with launching the program, obviously, and that caused us to have to take a delay. We've been very busy getting things up and running. Today, Jessica is going to be our fearless leader, and I'm going to turn it over to her in a second. We're going to be really doing two things. One, we're going to get a little demo on the data and some of the other information. Jessica's going to lead that section of the meeting. And the second part of the meeting, we're going to have a discussion that Will's going to lead, talking about additional or new bundles that we're going to add in 2023. I did just want to reiterate, I think we've said it before, we do need to get these additional bundles in discussion, or what we want to add in discussion in this first quarter right now, because we do have to work with CMS. It is going to be very difficult for us to add non-Prometheus bundles. So if you have a non-Prometheus bundle, you really need to reach out as of yesterday. If you're interested in one of the Prometheus bundles, then that's a little easier, but it still requires that you reach out. One of the things we are doing is MedChi has been reaching out to specialty societies, and specialty societies have been talking to us to try to set up meetings around specific bundles. Will's going to go into a little bit of detail about what we're looking at for which specialty. Some of the specialties that we've had initial communication with include ophthalmology, urology, and dermatology. There will be others, obviously, and we're very open to adding additional bundles in the three specialties that we started with: the GI, cardiology, and ortho. In fact, we have had initial meeting with some of the hospital ortho groups who've expressed an interest in adding additional codes in that space. So having said that, I'm going to go ahead and turn it over to Jessica and let her take over and go from there.
Thanks, Gene. To start today, I'm going to review is just sort of where we ended. Obviously, we spent the last 6 months basically go, try to get people enrolled. So let's talk about where we are from performance year one, and then I'll turn it over to my colleague at EQMetrics who will do a live demo of the data that's available in the portal. And then, as Gene mentioned, will kind of close us out. So first, obviously, a big thank you. I know our December 31st deadline, while we did extend it a week over the because of the holidays and the surge, we do appreciate everyone's due diligence in getting the care partner arrangement signed, and a huge thank you for UMS to be able to process that and turn it around very quickly. So where we ended, we actually have 50 different entities that are participating this year. And within that we're just shy of 2,000. So we have 1979 individual care partners who are joining us for this performance year. Our entities, actually those 50 entities range from an entity made up of one individual all the way to an entity that's just shy of 1,000 care partners. So quite a range that we have there. Additionally, you can see that the participation in those entities is varied as well. Again, we have some singular entities that are focused on just one singular episode, a couple that are doing two, and the majority of the entities are participating in more than 2 episodes. And where those episodes fall as far as categories and specialties is pretty even as well. Again, you can see 20 of those entities are doing a cardiology, 17 in gastro, and 25 are doing in orthopedics, which is wonderful. And the last step, sort of after we got the final care partner arrangements and the last audit from CMS, is CRISP and HSCRC did a final eligibility, which does impact probation status. So all entities should have received this information, but I just want to sort of reiterate the 3 things that were reviewed. Again, volume thresholds based off of the final list of care partners, we reran those volume thresholds to ensure that there were the minimum of 11 episodes minimum of 11 in each episode category and 50 in totality. Those episodes that did not meet that threshold participation was removed, but the remaining episodes participation was continued. Claim threshold. So we talked a lot about going into this, that 75% of the care partners within an entity had to touch at least one claim within that baseline period of calendar year 19. Everyone met this, so we were happy that we could move forward with that. However, those care partners that did not touch a claim in baseline were put on a probation status and therefore must touch at least one claim in this performance year to be eligible to participate in the next performance year. Again, all of the entities should have received a breakdown list of those individual NPIs. And finally, quality metrics. We reviewed in our last group meeting the different quality metrics. And what we did do is a final analysis to see where your baseline was, and entities that did not meet the minimum quality performance were notified, and actually we'll be able to see the detail when we go through this live demo. And just as a reminder, 2 consecutive performance years on probation does result in an automatic removal from the program. So again, if there are any questions associated with that, please reach out to our EQIP mailbox. However, all of your care partners and all of your lead care partners and administrative proxies should have received this breakdown for your individual entities. So if there are no questions on these 3, we'll hop into the meat of our agenda item, which is actually a live demo. And Nate, if you want to let me know, I can stop sharing my screen. Yep. And I will hand it over to you.
Perfect. Just let me know when my screen is up.
We can see your screen.
Great. All right. So there's a lot of information here. I'm going to try and get through the demonstration and all of the content in about 20 minutes. And then we'll have, I think we've reserved about 20 minutes for kind of discussion, questions, and answer. I would, just for the sake of making sure I adhere to our timeline, that we hold any questions to the end. But then we can certainly go through things. And Chris is, of course, happy to hold one-on-one sessions to go through this in more detail if, after you've had a chance to dive into it, you have any specific questions about the application, the data, or anything else. So all lead care partners, as well as administrative proxies, should now have access to this reporting suite. If you don't have access or aren't sure where to get to it, you can always reach out to the equip@crisphealth.org email address for support. I think we'll also include the production URL in the slides for this meeting as well. But when you get to the login page, it's going to be the same crp.crisphealth.org web address as the enrollment portal. You log in using the same credentials that you would for your general CRS account. And in this case, we are going to be using a demo site today, just because for each of you, you will have access to PHI and small cell counts in here. And we can't show that to the group as a whole. So the intent here is just to give you a flavor for the layout, where to find things. Don't worry too much if our demonstration data doesn't look right to you. So when you log into the enrollment portal now, you'll see 2 additional links active here. The first one, the View Performance and Savings Summary, is an aggregate non-PHI report where you can go in and actually see information on the entire program. So when you come in here, it's just a pretty simple report. Across the left-hand side of the screen, you'll see all 50 of the EQIP entities listed, along with the specific episode categories that that entity is enrolled in. And then what we provide is just a quick overview of the total number of episodes initiated, the total payments associated with those episodes, preliminary target price, and a preliminary aggregate target price, which is just the target price multiplied by the number of episodes. Because of the way the target price is set, you will see that the total payments and preliminary aggregate target price are the same. And we do only have baseline data available at this point in time. But as the claims come in for these episodes, now that they've started triggering, as those claims get processed and finalized, we will be updating this dashboard throughout the performance period on a quarterly basis. So these numbers will be up to date as soon as we have that claims data available, and you can come in and take a look at this. And the intent here is just really to kind of encourage folks to take a look across the state. If you want to be able to filter down to all of the entities participating in a specific episode category, you can do that using the filters at the top of the page here. Or if you just want to see what the presentation for your specific EQIP entity is, you can select your entity from the drop down here. And the layout of these filters is going to be the same here as it is in the more detailed reports that you will have access to for your specific EQIP entity that we will get to in a moment. I'll also highlight across the top of the page here, this control bar. It contains a number of useful functions. On all the pages, this EQIP dashboard button will take you back to the main landing page so you can navigate to other reports. This refresh button here will always grab the most recent data available. Typically, you won't need to use this, but if you are experiencing any issues with the report, a lot of times this will resolve those if your browser has data cached or something like that. And then finally, this revert button is useful as it will clear all of the filters that you've applied and return the dashboard to its original state. So if you're navigating through and end up in a place where you're not sure how you got there, you can hit revert. It'll bring everything back to the default view. Finally, on the right-hand side here, we have two export options. This print option will allow you to generate a PDF of whatever you're currently displaying on the screen. And this Excel button will generate an Excel export of the data that is specifically on the screen. And the only note there I would highlight is if you are in a report that displays small cell counts or other identifiable information, that you just handle that information carefully as you would with any PHI or data with small cell counts in it. So that's the performance and savings summary. Again, that's for the program as a whole. I think what most folks will probably take greater interest in is your performance dashboard. So you do have to have PHI access to get in here. When you enroll as a lead care partner or administrative proxy, you'll have to work with CRISP support services to get your account set up. As you go through that process, you should check off all the boxes to get this PHI access. But again, if for any reason you log in and this box is grayed out, like these ones, I would just reach out to CRISP support and make sure that your permissions are set appropriately. When you log in, you'll see on the left-hand side of the screen, you've got a number of different reports available, and I'll go through each of these at a high level now. At the top of each report, you're going to have a set of filters available. These will apply to all of the data on the page. Most of you will probably only have a single EQIP entity available for review. However, if you're an administrative proxy working with multiple EQIP entities, you'll be able to come in and select a specific one from this leftmost dropdown if you just wanted to look at the data for a specific EQIP entity. On all the reports, you can pull up information for specific care partners. So if you select from this attributed care partner dropdown, you'll see a list of all of the physicians enrolled as care partners with the selected EQIP entity. And if you pick on one of those, it'll filter the data down to only show the information for that specific care partner. And with all of these filters, Once you set a filter, you'll see this little icon appear right above it. Clicking on it will clear the filter just for that particular selector while leaving the other ones the same. The third selector will be for episode name. So again, for any one of these dashboards, if you only want to see the data for a specific clinical episode category, you can come in and select that episode category so that you can see it exclusively. And then finally, the last one here is the episode time period. So as I mentioned before, right now we only have the baseline period data displaying. It is displayed by the month of the date on the claim. So we've got claims from January through December of 2019 for our baseline period. As the performance period data rolls in, we will update this and you'll see additional time periods appear. And so, for example, once we have the complete performance period data, if you did want to go in and just view a specific subset of the data, you can make that selection here. I will also note as well that we've tried to build these reports out to give useful general functionality for a broad user base. We are going to be taking feedback, recommendations for improvement over the next few weeks to next few months, and we will plan on making an iterative update to these reports based on that feedback. If there's a common feature or data element that's not present here that folks really want to see or be able to access easily, so do feel free to reach out to the EQIP team to provide that feedback as you're navigating through. So the first dashboard here that we arrive on when we come to the performance reports is the target price summary. It follows the same format that a lot of these dashboards do, where at the very top, you will see a breakdown by trigger place of service. We know that episodes triggering in an inpatient hospital may have a different cost profile than one in an ASC. So you can see the breakdown of episode volume and cost by site of service. And then below that, you'll see the breakdown by clinical episode category. So for example, in this sample EQIP entity, they're participating in colonoscopy, knee replacement, GI endoscopy. So you'll see those three categories here. In all cases, we do make a user guide available. Typically in the production environment, that user guide will be available in the upper right-hand corner here, right next to your export options. If you open that up, you'll find a pretty extensive guide that goes through the different reports that we're going to be talking about today, information on accessing it, and as well talks about the different data elements that are presented. So if you do have any questions, this is a good first resource to go to help make sure that you're understanding all of the reports correctly. Now, one thing, again, I will note is that there's a lot of different use cases here. And so for some of these reports, it is a little bit more intuitive if you filter them before diving into the data. So for example, under this trigger place of service table, right now we are looking at all episodes triggered under the ambulatory surgical center setting. And since I have multiple different episodes selected, we are going to be blending those together. And so if you look at your total episode cost versus your target price, those will differ by default just because we are blending different episode types together. And if you go in and select a specific episode, now you will see that we are only looking at specific sites of service for this particular clinical episode category. So just a quick note on that. The second report is a place of service report. So again, this is really understanding where these episodes are occurring. The top table will show you the trigger place of service. Anytime you see that term, we're referring to the place of service where the episode started, where that diagnosis or procedure code in the Prometheus definition first appeared on a claim. Below that, we also display the first post-trigger setting. What we mean by this is where did that beneficiary first see care after the trigger event occurred? So it could be that they went, they triggered an episode in an inpatient hospital setting. And then after that, they were discharged to a skilled nursing facility. The first post-trigger setting would then be that SNF. We give the breakdown of the proportion of episodes that are going to each of these. Again, depending on the specific clinical episode category of interest, there might be different uses for this. For hip and knee replacement, for example, you might be particularly interested in seeing the breakdown of how many patients are going to home health services versus SNF services versus just outpatient follow-up in the community. But again, we can always get into specific questions on a one-by-one basis as necessary with follow-up. And as with the other reports, this will be updated with performance period data as it becomes available. The sequence of care report kind of builds on the place of service report by showing a more complete pathway for each of the episodes that are triggered. I would note for this one, there's a key down here at the very bottom of the page that explains what the letters in the episode sequence mean. But essentially what this is going to present is the ordering of sequence of care in an episode. So for example, the A in this list stands for short-term hospital. A is acute. C stands for outpatient or community. And so if you have a row like this, where it's simply AC, that means the patient triggered an episode in the hospital and then was simply discharged back to the community. And you can see the proportion of episodes that followed that particular care pathway and the costs associated with them. So again, just providing additional detail on where beneficiaries are going, what type of care they're receiving. And you will see, a long tail of more complex care pathways for some of those higher acuity patients in here. The fourth report is a provider comparison tool. This one's a little bit different than the other reports in that on the right-hand side of the page, you're going to see essentially a static data set for your entire EQIP entity. This will filter to a specific episode category if you select it. So if, for example, I only wanted to see my AMI data, I could select that. Now this is going to be showing me only the data on my AMI episodes on the right-hand side. And then on the left-hand side, you can select a specific care partner and look at the data associated with them. In this case, this specific dummy care partner only had a single episode triggered, but you can compare the cost and first post-trigger setting for that particular care partner against your EQIP entity as a whole to kind of understand how they compare to the rest of the entity. And again, if you want to revert the report back, you can just use this top button and it'll set all of the data back to the initial way. But just a good way to drill into data for a specific care partner compared to your EQIP entity as a whole. The fifth report focuses on post-trigger hospitalizations, and it's really a focus on individual providers. So since EQIP episodes can trigger in both an inpatient and outpatient setting, we do use the term post-trigger. However, if you're only looking at episodes that trigger in an inpatient setting, you can really think of this as a readmission report because it is looking at post-trigger hospitalizations. However, for an outpatient episode, this would include hospitalizations where the beneficiary triggered an episode and then was admitted for any reason. On this page, would just like to highlight at the bottom, we do break out all of the individual care partners, provide their episode volume for the selected episodes, the number with those post-trigger hospitalizations, and other data related to those episodes, but this episode volume count is going to be their total episode volume as long as you don't have any other filters applied. So this can be, even if you're less interested in post, oh, I'm getting a lot of feedback there. If everyone could mute. It is a good way to summarize the information for these care partners easily. If you just want to, for example, get a count of the episode volume for all your care partners, you can sort each of these. So now you've just got a descending list in order of number of episodes triggered here. Second variant on that same report, this is really looking at it more from a clinical view. So instead of breaking it out by care partner, we break it out by episode name for each of the episodes that you're participating in. We include some additional information on volume and post-trigger hospitalization rate. And then if you scroll down to the bottom, you'll see the specific DRGs that those post-trigger hospitalizations occurred in. If you want to look at why these patients are getting readmitted or admitted to the hospital after the triggering event. Second to last dashboard is a summary of potentially avoidable episode complications. So in the Prometheus documentation, the episode grouper logic defines specific adverse events that are defined as potentially avoidable during the course of the episode. So this dashboard is going to give you a breakdown of all of those events. The top dashboard will again display data by episode category. It'll show you the total number of episodes that had some of these potentially avoidable events out of that total, and the percent of payments that contributed to services, procedures, or diagnoses related to those potentially avoidable complications. I will highlight here, there's a little bit of a nuance, and this is covered in the documentation as well. For the columns labeled PAEC or PAC, those are potentially avoidable complications that the Prometheus episode grouper logic is fairly certain are avoidable complications. However, for certain types of inpatient claims, just the way that the claims are coded and processed, it can be difficult to determine with absolute certainty whether it's a complication for that specific episode or routine care. And so that these last few columns here where they say typical complications, those are cases where those events are potentially these complications, but maybe routine care for that specific episode type. We do call them out for informational purposes, but it may be worth digging into the specifics of these a little bit more, and we'll talk about how to do that in just a moment here. If you scroll down to the bottom, you'll see that we provide a lot of detail on the type and group of those complications. And again, this will vary a lot depending on the specific episodes that you're involved in, but we do break out a lot of different complication groups as they're identified again in the Prometheus episode grouper logic. So you can take a look at specifically what those complications are and how many episodes they've impacted. And again, all of this is filterable by specific care partner, episode name, and time period if you want to get into a bit more detail. The last dashboard that we're making available right now is a quality score summary. So as everyone's hopefully aware, there are 3 quality measures that EQIP entities are being evaluated on for the first performance year. This dashboard will give you your raw performance rate, your score based on the performance against the statewide percentile rank, and the resulting performance rate for those 3 measures. In the middle of the dashboard here, we also provide the numerator and denominator, so you can see how many episodes are actually contributing to each of those measures. And then again, finally, at the bottom, we do provide a breakout for all of the individual care partners, though we would highlight that the quality scores are ultimately only calculated and evaluated at the EQIP entity level. So this is really just for informational purposes and identifying care partners who could use help, especially if it's related to more of a coding and billing issue as opposed to clinical care. But this will give you that breakdown of how all of the different care partners in your EQIP entity are contributing to that quality score. Now I know hopefully these reports provide a lot of the information that everyone needs to monitor the program, to understand the baseline period kind of on a day-to-day basis. We do know that there will be some users who want to dig into the data in a little bit more detail, however, and so we are providing raw data extracts as well. Those aren't available in production today, but they will be made available early next week. And I will log into another environment here really quickly just to show you how you can access those. So what you'll see after Monday is at the top of the page, there's an additional button in this bar here that says DEX, that stands for Data Exporter. When you click on that, you will come in to the Data Exporter tool. On the left-hand side, you'll see a couple of different options, but the main one that you'll be interested in is this Download Data button. If you click on this, you'll get a set of files that I'll go through in a minute, but they give you more detailed data in CSV format that you can pull into your analytic software of choice and transform it, edit it, view it in a way of your choosing. There are two summary files that are available that I'll go through really quickly here. The first one is a summary file that is an episode level file. So you'll have one row per episode. It'll include the episode name and identifying information, along with unique identifiers for the episode, the beneficiary, and the attributed care partner so that you can link these across data sets. And there's about 50 different data elements we include here, along with beneficiary demographics, more detailed payment information. So you can come in and take a look at all of those components. The second file is a linking file. This is going to be a much narrower but long file that includes all of the claim IDs that were pulled in to construct the episodes, again, according to the Prometheus grouper logic. So you'll come in here, the EQIP entity, episode ID, member ID will be the same as those presented in the summary file, but you'll have all the claims associated with each of these episodes. You would typically expect, 10, 20, 30 or more claims to be pulled into a specific episode. You can find that here. Now, if you want to dig into the specific data, again, early next week, there will be another button available to download the raw claims extract. These raw claims extracts are very large files. They include all of the claim details for all of the episodes that are detailed in that linking file. But if you do want to dig into it and be able to look at all of the specifics, you will have that available. We do recommend using analytics or database software if you're going to use those files. Depending on how many care partners and episodes you have, they don't necessarily play nicely with Excel, but they are available. And again, we can go into greater detail on the specifics of those. Happy to follow up later. There's a lot to get into in those files that we don't have time to dig into today. But I will highlight, similar to the documentation available for the performance dashboards, if you click on download documentation right here, there is a user guide specifically for the data exporter that walks through getting the files out and it specifically highlights all of the data elements and provides definitions for everything that you're going to see in that summary file. So I would definitely refer you to look through this if you're interested in taking a deeper dive into those detailed files. Finally, again, most of you are probably familiar with this, but we do make reference to the EQIP policy guide throughout this documentation, just so that we're not replicating information that's displayed elsewhere. That EQIP policy guide is available on the HSCRC website under the program materials and information. And it does contain more detailed information about how a lot of the specific values that are contained in the reports and data are calculated. And we will include a link to this as well in our documentation so that you can pull it up if you haven't had the opportunity to do so yet. With that, I will pause and Jessica, hand it back to you to moderate any questions and discussion.
Yeah, not a problem. Thank you, Nate. I'm going to start just with the questions that came in through the chat. And if you ask the question and want to just unmute yourselves to further explain, feel free to do so. Some of it's regarding like the ease of seeing the data. So the first question was just about is there an easy way to export individual scorecards without having to go in and filter under each individual care partner? Obviously, for our larger entities that have 50 plus providers, that would be quite a few clicks that they would have to do to kind of pull that individualized data.
Right. So as of right now, there aren't any individual scorecards designed and built. If that is something that's going to be helpful, though, that it's definitely something that we can implement. I think I would just be curious to hear, what specific data elements you'd want included in that scorecard out of all the data we have available. Otherwise, we're happy to take a crack at that. But for right now, this initial data run was primarily focused on helping lead care partners, admin proxies, and folks at the state understand the data at the EQIP entity level. So unfortunately, at the moment, we don't have an easy export for what I would consider a care partner report, but we can definitely work on those to include them in a subsequent update here.
I would say that, we want, providers to be held accountable for their performance, and they can't do that if they don't know what the performance is. And so it's very important to actually get them, the data so that they can, see where they are, relative to, the rest of the, of the cohort. It's great for the administrative proxies and others to have it, but we're not the ones that are actually doing the procedures. And so it really needs to be in the hands of those that, should be accountable.
Yep. No, totally makes sense.
Nate, I would just add, we are planning to revise the portal and the tool so you can see multiple care partners at the same time. So currently that view allows you to see one care partner at a time. We'll add a way for you to see all of them. But as far as exporting individual scorecards, if you have suggestions, please let us know. We make all the data available to you so you can create your own scorecards and provide that to your physicians. And if you have suggestions on how we can make the tool better, we're happy to consider those.
One of our other questions that came in was to go into a little further detail of what the post-trigger hospitalization count is.
Sure. So there's essentially two data elements on that report. The first one, the post-trigger hospitalization. Hang on, let me pull it up real quick so we can be looking at it together here.
Hey, Nathan, I think I can be more specific about my question.
Yep.
Yes, I was trying to figure out what episode with post-trigger hospitalization and why that one number doesn't match up with the two columns ahead, post-trigger hospitalization count. Does that mean? Yeah, so if you could just kind of explain that.
Yep, so this is simply the number of episodes in which one or more post-trigger hospitalizations occurred. This post-trigger hospitalization count includes all unique hospitalizations. So if I had one beneficiary who had 3 post-trigger readmissions during the episode global period, you would see a 1 in this column and a 3 in this column. So it's just, if you see a big difference between these two, it means that patients are getting readmitted multiple times during the course of the episode.
Got it, thank you.
Yeah, this is Tim. So how's that being advocated against a true post-trigger event related to avoidable readmission versus, for example, something comes with acute MI, PCI, and then 2 days later, a week later, it comes in with cellulitis of the right lower foot unrelated to the procedure? How's that being accounted for?
So right now, this is a basically all-cause hospitalization measure, especially with the variety of clinical domains covered by EQIP episodes. This is not intended to be a like unavoidable or avoidable readmission count here. Jessica, I'm not sure if you can comment any on plans around that at all. But to be sure, it's not an avoidable readmission report. It's an all-cause readmission report.
Yeah, so I don't think we have plans to revise that, but I would just remind you that the Prometheus methodology includes a list of related costs to the episode. So it's relatively unique compared to BPCIA or some of the other national bundled payment models that include all costs. And so the Prometheus algorithm does its best to identify costs that would be clinically related to the procedure and the episode that was performed. And so hopefully would exclude, an unrelated cost. I think that we're happy with the Prometheus methodology. If you have questions about a specific episode, we're happy to take that offline and chat through with you. I don't think we have plans to go further than that and try to figure out, within the post-trigger hospitalization count, what is avoidable and what is not. I think we'd be relying on the Prometheus methodology there. And here we're just reporting, how many post-trigger hospitalizations occur. Does that make sense?
It makes sense, but when I talk to my individual doctors, it's challenging to educate them and reduce costs if we don't know exactly what, the specific metric we're talking about.
Yeah, so we have on our website something we call the EQIP episode playbook that has the lists of triggering codes and related costs for each episode. And so, I think you or your folks could go through that and identify what is related, what is not related. If you have questions about that specifically, we're happy to take that offline and go over it with you.
Thank you.
Tim, I think you actually were at the next question as well. You were asking about how cost is defined in a TPR environment with the understanding that charges are adjusted based on volume to meet the TPR cap. Also, is it all charges in an event or specific charge codes being tracked? So I think that latter part we mentioned that there are relevant costs, so it is specific charges.
Yeah, and I'll just maybe explain a little bit better what I'm not a CFO, but the way the CFO is explained to me on a TPR cap methodology, if I do a PCI and our volumes are low that year, the charges are up coded to meet the TPR cap that's agreed upon, and if our volumes are high, the total charges are down coded. So how's that being accounted for in the cost methodology that we're reviewing here?
Yeah, so that's a good question. So we do our best to use what we call standardized charges. So we set a rate every year for each hospital and each rate center. As you noted, the rate that's actually charged to patients can vary up or down in order to meet that GBR value. What we do though is we recalculate all prices using that standardized rate, so they're volume invariant.
Okay. Thank you.
The next question was just about the making available the breakpoints for the quality scores. We can definitely send that out. I think that was included in last month's materials, but we will, it was quite a long presentation, so we can consolidate that and make and send that out. The next one was about, is the performance year triggering event restricted to places of service in Maryland? So both for baseline and performance, it's all Maryland Medicare fee-for-service beneficiaries. There are some exclusions. See our policy guide that's on our website for those, but they'll be included regardless of location of their triggering events. So therefore, if you have Maryland beneficiaries who are getting care in DC, Virginia, they are not impacted and would be included. Sorry, one second. Next question is, thanks for, will the data extract include information at the beneficiary level? Any proposals to include beneficiary level data on the performance dashboards? And this was by Sharon. So if there's anything specific that you're looking for, please unmute yourself and we can discuss.
Right. So I think in general, we have to make trade-offs between providing as much information as we can, but also making sure that it's usable and approachable for, high-level examination. So our strategy right now is we're going to be providing both EQIP entity level data and physician level data through the portal, and that the beneficiary level data will come through the DEX file that Nate demonstrated. So it's our intention to make all of this data available to you. I think just given the number of different ways you could cut a beneficiary level analysis, we're going to leave that up to you rather than trying to satisfy all customers through the one portal, which would result in an overwhelming website.
Okay, and then our last question that came in on our chat before we open up to people who just want to, ask it out in the open. It's just about the process for adding additional lead care partners. So the way we did lead care partners in enrollment is you listed that person's name. That portion of our portal is closed outside of that enrollment period. So for the time being, please have your lead care partner send an email to the equip@crisphealth.org requesting access for that individual. Please include first name, last name, and email, and then we are able to give them access on the back end, assuming that we verify that everything is needed to grant that PHI level access. We've also had people like, if you sign a letter saying this, that's fine too. I know sometimes it's hard to get a hold of your lead care partners, but it does need to be initiated by them since we are ensuring that this PHI level data is only available to those who have been granted that provision. And then lastly, is the list of Prometheus episode groupers available to make recommendations for 2023? So yes, again, we'll point out, and we can send this out to that the episode playbook that Will mentioned. It has that level of detail of triggering codes as well as diagnoses and the relevant costs included in the grouper. And if there are any questions, please email the equip@crisphealth.org and we can discuss.
So actually, Jessica, I think that episode playbook only has episodes that we've already included.
Right.
Oh, I apologize. I understood the question. Yeah.
Yeah. So the Prometheus episodes are available on the Prometheus website. And then we're going to talk in a couple of slides about the ones that we have our eye on. If you we're going to talk about those. If there are episodes that are not on that list that you're eager to add, please let us know. And we can provide the link to the Prometheus website where they list all of the episodes that they have in case you want to peruse that.
Is that available and open though? I think we had an issue before, Will, where you had to have some kind of access, or can we maybe produce just a high level list to see if there's interest, and then we can help people and send something out.
Sure. So the high level list is available on the website to anyone.
Okay.
The codes and that sort of stuff, you'll have to work with us to see what procedures are included, but we can just grab the list of episodes from the Prometheus website, included in email after this meeting.
Okay. Thanks, Will.
So those are the questions that came in over the chat. If there is any other specific questions related to the performance dashboard, feel free to unmute yourself and ask it now.
Hi, Jess. It's Renee Kilroy with Luminous Health. I have a question about the performance summary and the total payments, the preliminary target price, and the preliminary aggregate target price. Nate had mentioned that those numbers are going to change as the data comes in when we're hitting claims. Right now, when I'm looking at the information, the preliminary target price is the 2019 baseline data. So are the target prices going to change, or is it just the total payments that are going to change?
Sorry, I misspoke. The target price will remain the same. What we'll be updating is you'll start seeing the episode counts and payments associated with episodes triggered during the performance period added into that dashboard. And that'll be a second set of columns. You'll basically, right now, it's just the baseline data. You'll see both the baseline data and the performance data once that's available. But the target price will remain the same.
Okay, so the target price is the baseline data.
Correct.
Okay, and then just one minor recommendation. I noticed as you were going through the screens, you're able to pick different time frames. It's helpful to see what time frame you're looking at the top. I noticed there wasn't a header.
Yep. That is easy enough to add in.
Thank you.
Yeah, if I could just add one amendment, Nate, to what you said. So the target price is the baseline data times the inflation factor from 2019, and the values that you see in the tool are, I think, in current year dollars. So they include the inflation factor. But just be aware that that number is not going to tie to the 2019 data because of inflation that's occurred between 2019 and now.
Okay, if there aren't any other questions, we will move on to the last portion of our meeting. Apologies. Sure, let me see if you guys can see my screen. And Will, I'll hand it back over to you to talk about performance year 2.
Thank you, Jessica. Would you mind going on to the next slide? So we've started thinking about what additional episodes we want to add. What we've done here is identified some priority areas by specialty group that we think might be interested in participating in the EQIP program. And we've listed each one of the episodes from the Prometheus lists that correspond to those specialty groups. So if you're on one of these if you're in one of these specialties, we'd be happy to talk to you about potentially participating. And we can do a walkthrough of the general EQIP program, as well as what's included in each one of these episodes. If you're in a specialty that's not on this list and would like to be participating in EQIP in the future, please let us know, and we can walk through with you what Prometheus episodes are available for participation and get those added. If you're in a specialty group or in one of these specialty groups and you know of an episode that is not included on this list, if you have an idea for an episode that is not included on this list, we're happy to work with you to develop sort of episodes that don't fall within the Prometheus, the existing Prometheus groupers. The difficulty there is that there's a lot of additional work in developing our own grouper. We're happy to do that and we're happy to work with you, but we do have some time constraints. And so it's not 100% certain that we'll be able to add that for 2023. That being said, we're happy to work with you for inclusion in future years. So if you have an idea for an episode that's not one of the Prometheus episodes, please let us know. And please let us know sort of sooner rather than later, so we don't end up with a time crunch later on. For people in those specialty groups, I think, Gene, we are planning on reaching out to some specialists and starting a conversation about what is included in EQIP and what is included in the Prometheus groupers. So look forward to that. I don't know if Gene, if you want to say anything else there.
No, I would just ask if you know any of the anyone in that group who's interested, send them our way. We're going to try to work through the state specialty societies so they can coordinate and reach out. And Will and I are going to be kind of quarterbacking this. So I think where we're looking at, and Will and I discussed this yesterday, we're probably going to be looking at doing some type of educational meetings in late February, early March around these specific calls. And we'll do it specific by specialty, so we can give details around the specific codes. And I guess I just reiterate what Will said. If you're in another specialty, or there's something on the Prometheus code, or you have a group at one of the hospitals, or there's a specialty society that's really excited about one of the other Prometheus codes, please reach out to us right away, because we really need to get planning and moving in this first quarter of 2022 in order to get through the CMS process.
Right, and I think Jessica did send out the link to the Prometheus episodes with the list of all the definitions that are currently available. Jessica, would you mind just also sending that out as an email to the attendees after the meeting? So if you go to that link and you look at the Prometheus episodes, you can pretty quickly identify, what potentially could be added to EQIP.
So I see too, we have a question in the chat from Tim about quality metrics. And Tim, we're going to do a little more work on this. Jessica and I are going to do a little more work in this in the CMEs that we're going to be doing to educate people. But just because the hospital does most, it's really important that the modifier be billed in order for it to be counted, because the way the quality metrics are going to work is, and the question is essentially, if the hospital does most when someone comes in, does that meet the requirement for the quality metrics? I think the way they're going to measure the quality metrics is they're going to look to see that the modifier with regards to end of life, or there's also a full CPT code for a full 20 minutes, which I don't think the hospitals are doing. If one of those two are billed, I think you'll get credit for it. And if it's not, so just because they might do a most intervention when someone comes in, that doesn't mean that they're actually billing the modifier. So I believe it's a little more complicated than that. Sorry, Will.
No, that's fine. I think in addition to talking about the quality scores through your forum, Gene, if folks want to reach out to us, we're happy to have a conversation about how we identify the quality scores and what codes are being used. I do want to reiterate what you said, which is that all of our information has to come through claims. And so if you're doing something that isn't being tracked on the claims, we're not able to pick it up. So the bad news there is that in order to get credit for it under EQIP, we would need that to be coded. The good news is if you're already doing it, improving that level of in the quality score, I think is going to be relatively easy after a conversation with your coding people.
I will say this too. Jessica and I have talked quite a bit about the issue of these coding and these quality measures. So if there's anyone who's struggling with this or thinking about this or thinks there might be something that we could do from a utility point of view to make this easier for you, we'd love your suggestions or ideas, because we think that there might be ways that we can make it easier, and maybe there could be economies of scale. So we'd love your suggestions or ideas. But I just think it's really important in month one that we've just completed in EQIP for you to go and check and make sure that you're billing the appropriate codes and modifiers, so you're going to be successful on the quality, because it's going to be a lot harder to fix it in month 6 than it is in month 1.
And I can resend out after this meeting, the codes that we are tracking. We have a summary sheet for that.
So I see Erica Jordan has a question about the CTP, the G codes. So Erica, if you send us an email, we're happy to get back to you on those particular G codes. I think if my memory serves correctly, those are exclusions to the measure. And so I'm not certain that, that the discontinuation of those G codes is necessary to track patients. Those G codes were used to exclude people from the measure. I'm not sure that that they've been replaced, but I also don't think it's critical for those to be replaced in order to have the right tracking codes added to the claims. But again, I'd have to check those codes in particular. And so if you want to reach out to us, we'd be happy to have a conversation with you. And Jessica, I don't know if you go to the next slide. I think I'm done here.
Actually, yeah, we went through our meeting a little quicker than we thought. But so as both Will and Jean mentioned, there are resources available for you online. I will follow up with this email sending links and or the PDFs themselves out to this group. But also just want to reiterate that all Chris, MedCai, HSCRC, we're all available to meet one-on-one, particularly with those interested in performance year 2, as well as after you've had a chance to review your baseline data. Feel free to reach out with questions, or if you'd like a little some time with us to look at the data, we're happy to do that as well. That's all we have on the agenda today. Oh, a couple more chat questions.
So Jessica, I think our chat questions, we'll follow up with Erica after this meeting. And then Jason, we have the user guide available on the website that I think should answer some of those questions. but they are getting a little technical. So rather than boring everyone else on the call, how about you just send us an email and we're happy to answer directly. Okay.
With that, just thanks everyone, and we're back to our normal cadence next month. So
And just please reach out if you're interested in adding codes. And for those of you who, if you work with larger hospital groups, please take a few minutes and talk to your physicians and see what the interest level is. So that's really important that Will and Jessica and I need to hear from you because you see the list that we're kind of working on, and we've had some level of interest. I think the one group that we didn't include on that list was the ER group, which we've been working with, obviously, Will, and that's the one that's outside Prometheus. But again, if you know of anybody else who's interested, you've got to get with us soon because we're just not going to have time to add if you don't get the information to us. So that's the one thing I really want to drive home today. And having said that, are we done, guys?
We're done.
Well, thank you, everybody. Thanks, Will. Thanks, Jessica.
thanks.
Thank you all. Bye.